Hi, my name is Dustin. I'm a respiratory therapy coach and respiratory therapist for many years. And a question I've been asked by patients is, I have a BiPAP machine or my mask is leaking a lot. Why is that happening? And is there anything we can do to fix it? Well, mask leaks on CPAP machines or BiPAPs usually happen around 15 pressures or higher, or EPAP pressures of 10 or higher. It happens to a lot of people. Also can also be the structure of your face is not perfectly aligned with your mask. I'm gonna break this down with you guys. What's actually happening is your mask isn't failing, is that the pressures are getting to a point where it's starting to leak around the plastic. So silicone mask is what we use, not gels, not cloth. And so it's going to be a fixed structure. And everyone's face is different. We're all designed differently by our maker. And so we have unique structures, especially as we change, as we get older, or we gain weight, lose weight. Our first thing that goes away is in your body is the facial fluids, and then everything else goes away. So also, you gotta be aware of your movements on your face. So if your jaw moves, that's gonna move the mask, okay? You move your head side to side, or if you're lying on the bed or your pillow, that's going to change the seal on your mask. And depends on the kind of mask you're wearing. Is it going to be over your nose and then going down? This is going to, this shape here is the most challenging to seal because your jaw is moving, your head will move, and then the shape around your nose is always unique for people. Another challenge, if it's under the nose with this, it's challenging because every time you open your mouth, it moves. See that? So you have to force it tighter and tighter and tighter, which forces your jaw back, which opens your mouth anyway. So you understand what I'm doing? So how do we address this? There's different styles, approaches we can go through, but I'm going to go over the most commonly sleep study tested masks that are available in the market, and then what we can add extra tools to help you seal. So does this vary between men and women? Yes. First of all, men and women's structures are different. Men have broader jaws and have facial hair, okay? Where women don't have broader jaws and don't have facial hair. That makes a huge difference on the sealing on the mask. Plus, men have facial oils due to their beards that makes it difficult for the mask to seal. Women tend to have higher skin sensitivity and do not like certain straps on their face. So be aware that everything can cause micro leaks due to micro movements. And the purpose of this mask is to help you get high quality oxygen and to improve your opportunity to have REM sleep. REM sleep is where we have rapid eye movement, allows your body to heal and to slow down your body, increase your metabolism, and decrease your cortisol. You want to increase metabolism and decrease cortisol. Ever notice how your body starts to calm down when you sleep? That's your body going back into the metabolistic state. When we rest, we digest and we heal. When we're active, our cortisol goes up and we want to fight and defend. But when we rest, it's how we develop our oxygen reserve, which allows us to have those nice deep breaths when we're exercising during the day. So I want to go over the most common masks in sleep studies. The first mask of choice in sleep studies, if your pressures are at an IPAP, which is inspiratory pressure 15 or above, or CPAP pressures above 10 to 15 range, the sleep studies have shown, and research is at the ResMed AirFit F20 or AirTouch F20 have been the most effective. The most consistent seals under high pressure, strong tolerance to jaw movement, and standard titration in the standard titration labs. Let me show you an example. So this is a ResMed AirFit F20, which also has a foam version for skin comfort. You might want that one in case it's more difficulty being comfortable with the silicone on your face and allows you to have a little bit more of a, some people has a tighter seal. But the silicone keeps its shape, so it has a tendency to be more durable to pressure changes. So usually the foam's just for comfort. Another option that people found that's a hybrid version of this called the F30i ResMed. The difference is that it's under the nose and attaches from top. It has been shown to have a much similar seal to the full face, but allowing people to have more comfort on this area of your nose. This is the most common discomfort right here because it's very thin tissue here. And this can break out in a lot of people. If you notice that you have acne here a lot, anything gets here, it's very sensitive. Your nose has a lot of nerves and senses. It can sense hormones, it can sense food, it can even respond to different dangers in your environment or arousal. This area is very sensitive. And allergens in the air, I'll add that too, because people get sinus congestions because your nose is reacting to your environment. Very helpful the anatomy that our God has given us to allow us to be able to respond. But if you put pressures on it, it can lead to quick irritation. The next mask I'll show you that's also effective for a lot of people who move a lot is our T-piece design Vitera mask. I'll give you an example right now. Here you go, the Vitera mask. What it includes is a T-piece that allows to have an even pressure on your face. It tends to show in clinical trials less leaking when it comes to people who move a lot, but the most effective one is our F20 ResMed. So what are some sealing mask tools we can add to the mask? Let's say you already have this mask, the doctor prescribed you a certain pressure and it's still leaking. What can we do? Here's some things that you can do. First, it's called a mask liner. There's different brands out there, but basically what it does is applying a thin cloth that goes over the silicone mask. So what that does, it helps absorb oils, improve comfort and cushion grip, and it helps with those micro gaps that happen when we move and reduces leaks at higher pressures. So this cloth is breathable, allows your skin to breathe, and it helps seal up those extra spaces that doesn't fit. Cool? Also we can do is adding strap pads. What's a common misconception is that the tighter I put the mask, the better the seal. It actually throws off the function of the mask. You want it to be center on your face, not pulled one way or the other, because you're going to reshape it and cause the pressures to not go where they need to. The best thing is when you put your strap on, you have at least 2 or 1 fingers that can fit underneath the straps. Not too tight, we're going to leave marks on your face. Add liners and padding on your straps. Okay? What it does, it helps protect your skin, helps also decrease the sweating, and help absorb some of that oils and keep an even support on your whole face. This is all very important. A next thing I like to add is called a CPAP pillow. There are many types out there. There's Contour, which is a very good brand. There's others out there. Contour is known for many years to support people who are trying to have proper ergonomic alignment. Ergonomic means in line with the spine. Everything's in line with the spine. I've seen this in many chiropractic offices that have been using Contour for many years. It's not the only thing out there, but it's a good product that you can think about. The whole idea is to be able to move your face and have support where you need it. Okay? Your spine's in a line and allows space for your mask to move around where it doesn't pull it off your face. That defeats the whole purpose of a CPAP mask if you can't get the pressures where you want them, which is deep in your lungs. So we definitely need to make sure we optimize our mask. This is done by improving 70-80% of that by having proper mask, proper fitting. Having a proper fitting means it fits perfectly around your nose, best as possible. Then adding a liner and cushions and a CPAP pillow. All those things will help improve your sleep time with your machine. There's many different types out there, but make sure you get something that fits exactly for your mask. So when I search for a liner or a strap cover, I'm going to literally look up the mask itself. So if I had this mask, an AirFit F20, I would go online. I want a liner for my AirFit F20 mask. Boop, and see what it pulls up. If you like the material and the way it looks, you can get that and have it sent to your house. Most of them are reusable and they have a large supply. Then what you do the same thing for the straps. See, I don't like my straps the way they are. I want a specific cloth cover that goes on these straps. I do the same thing, F20, and I look up the straps. That's simple. Now let's think about this. We talked about the masks and how to help them fit and the reasons. The whole point of this is to help you have oxygen deep in your lungs, to help your heart, your mind, and your body heal. Oxygen provides you cellular energy, and cellular energy is how our body is able to function in this life. Now, if you're having difficulties breathing outside of pressures and ceiling leaks, please consider the other options of help improving your lung health. Removing toxins, breathing exercises through your nose, out your nose, adequate exercises, good hydration, a balanced nutrients, adding extra vitamins and minerals to help support your body. And overall, continue to do what's best for your body because you are the shepherd of your body. It is a huge pleasure to help you be more comfortable with your pressurized mask and be able to add the seals and the liners and the pillow advice and other things out there to help you. And thank you so much, and God bless.